It was 9 a.m. on Saturday morning. Daniel, with his brothers, accompanied their father to the farm as usual. While Daniel and his brothers were harvesting maize, their father was fetching firewood. And suddenly a shout came out from Daniel, "Daddy, Daddy!" And his father dropped what he was doing, ran towards Daniel. When coming, Daniel's brothers were running after a snake while Daniel was holding his ankle and screaming. His father shouted for help. Neighbors came around, and some of the neighbors accompanied Daniel's brothers and they were running after the snake. Some other people came in. Some brought a rope immediately and they tied Daniel's ankle. Some started cutting Daniel's leg with a razor. Some were applying traditional herbs and what they call black stone. And another person even suggested that the leg should be sucked, that somebody should use his mouth and suck the venom out of the wound. The question then is, will Daniel survive this snake bite? If you are new to our channel, please subscribe and turn on your notification buttons so as to receive our videos whenever we put them up. Guess what? Daniel was brought to the hospital about 1 hour 30 minutes after this incident. This was horrible, very terrible. There are a good number of mistakes in this Daniel story, so we are going to be analyzing these mistakes and correcting them so that next time you may just be the one to save another person's life. Number one, there was a lot of panic and chaos. Notice that when there is a lot of panic and a lot of fear, it causes the heartbeat of the person that has been affected to increase. And when the heartbeat increases, what does it do? It pumps more blood to the system. And so it's going to circulate the venom into the system very fast, and the person can lose his life in a shorter period of time. Number two, they spent a lot of time, and that time was spent trying to chase the snake. A lot of people were running after the snake. Now, when the snake has bitten one person, what you do is avoid that snake biting another person. When you are running after the snake, it can easily bite another person. Notice, your focus is not the snake. Your focus is the person that has been bitten by the snake. If you can identify the color of the snake, it is okay. If you are further from the snake and you can take a snapshot, it is okay. Okay, you just need to come to the hospital. We, the doctors, will be able to determine if it was a poisonous or a non-poisonous snake from the nature of the bite. You don't have to catch the snake to bring to the hospital. Number three, they spent a lot of time trying to cut the wound with a razor blade. When they are cutting the wound with a razor blade, they are thinking that it will help to release some of the venom. But before you start cutting that leg, a lot of the venom has already moved into the tissues, and cutting the leg will rather be increasing the pain the patient is in, and is going to be causing more entry of bacteria, and it can lead to infection. So you are causing more harm to the patient. Number four, they were trying to apply what they call black stone and some herbs on the wound and whatever, and they are thinking that the herbs are going to try to neutralize the poison. Now, the problem is not if the herbs will work or not. The problem is the time wasted. The time you are wasting is precious. When you have a snake bite, every precious minute is very, very, very delicate. So you don't waste that time, because that time can lead to the death of that patient. Number five, one of the most worrying that I heard in this story is somebody trying to suck the venom with his mouth. How does that work? I'm sure you have seen this in films, but in reality, it's not so. Sucking the venom with your mouth will not go in any way to help. Even if it does help, you cannot suck enough venom out with your mouth. And the danger is this: if the person sucking the wound with the mouth has a cut in the mouth, that venom can affect that person. So you doing that can easily get into trouble. So don't suck the venom with your mouth. It's not going to help. And one of the last and most funny practices I hear people do, and which was done in Daniel's case, was trying to tie the ankle as tight as possible so that blood will not pass. No, you can't stop blood that has been affected by the snake's venom from flowing in the body. It will flow whether you tie the leg or not. As a matter of fact, tying the leg so tight can be rather very dangerous, because it is going to inhibit or stop blood flow to that limb, and you can lose the whole leg while trying to prevent a small part of it. So don't tie the leg. It can be dangerous. It can cause the whole limb to be lost. The last one, and not the least, is they were trying to help Daniel walk. They were supporting him walk to the car. No, you don't do that. You don't support somebody that has had a bite from a snake to walk. No. As they are walking, they are going to be helping that venom to circulate even more faster. So what you do is what? You immobilize. If the snake, like in this case, touch his ankle, you are going to make sure that you use maybe some planks or sticks to immobilize, to make sure that that leg is not moving. You tie it and secure it and make sure that it does not move. And then you carry the person. You carry the person as much as possible. You can carry the person using a car or whatever, but let the person not trek, let the person not walk on himself. That is not a good practice. And one advice I will give to you, as you are carrying the patient to the hospital, if there are any rings or any bracelets around that area that was bitten by the snake, make sure you remove them, because sometimes the venom can circulate so fast in the body and it will cause swelling. And when there is swelling, those rings sometimes will not be able to come out again, and it may be so harmful to the patient. So make sure that if there are rings or any chains or whatever in the body, you remove them, especially at the area where the patient or the person was bitten by the snake. So in conclusion, if there is something that you retain from this story, when you are in a scenario of a snake bite, time is the essence. Every 1 minute counts. Don't waste time trying to chase the snake. No. Don't cut the wound. Don't try to suck. Don't try to tie the limb. No. Don't do that. Time is very essential. If you are in this scenario, make sure that you immobilize. It means keep the person calm. Keep the limb that has been affected calm, and as much as possible, transport the person to the hospital in the quickest way you can do. Most of the times, what determines the outcome is not the snake itself, but it is what you do in the first 30 minutes of the snake bite. If you have watched this far, thank you. Please do well to subscribe to our channel, turn on your notification button so that you'll be the first to notice our new videos. Thank you.